Today, I'm going to discuss chemotherapy in veterinary practice and the guidelines and treatment schemes. Chemotherapy in veterinary practice. What is chemotherapy? Chemotherapy is a type of pharmacological treatment that is used to destroy or delay the progression of cancer cells. Many of the medications used to treat cancer are derived from natural sources such as plants, trees, and even microorganisms, and are frequently the same compounds used in humans. Some medications offer a broad range of effects, while others are more focused. How does chemotherapy work? Chemotherapy drugs attack cells in the process of growth and division. Individual medications may function in a variety of ways, including causing damage to a cell's genetic material or stopping it from dividing. Chemotherapeutic medicines, on the other hand, are unable to distinguish between malignant cancer cells and normal cells. This suggests that chemotherapy may be susceptible to quickly dividing cells. Toxicity to normal rapidly growing or self-renewing tissues in the body is the reason for most of the side effects seen with chemotherapy. Chemotherapy seldom causes permanent damage to normal tissues since they continue to develop and heal themselves. When do we use chemotherapy to treat pets with cancer? Chemotherapy may be used as the primary treatment for certain cancer types or may be used in combination with other treatments such as surgery and radiation therapy. In some cases, chemotherapy can be used to try to shrink large tumors prior to surgery or to help eliminate microscopic cancer cells that cannot or have not been completely removed surgically. For cancers that are at high risk for spread, chemotherapy can be used after surgery to help delay or prevent the appearance of cancer in other parts of the body. Lymphosarcoma, leukemia, and solid tumors wherein bulk of tumor has been destroyed by surgery, cryosurgery, or radiation but the risk of metastasis is high. Considerable care should be taken before starting chemotherapy since they are highly toxic. Guidelines and treatment schemes. The following are the guidelines that we should always remember. Number 1. A detailed clinical and radiological examination should be made and the tumor should be clinically staged. Number 2. A histological examination is required and prognosis should be obtained. Number 3. We need to acquire adequate background knowledge before therapy. And lastly, full cooperation of the owner is essential. We should remember all of these things because before any treatment is started, the recommended treatment, the reasons it is recommended, the procedures to be carried out, the expected or possible side effects or complications, and the expected benefits are all explained to the owner. Knowing how anti-cancer chemotherapy drugs work and what to expect from the treatments can help pet owners decide on whether such therapy is appropriate for their pets. And now let us proceed to the treatment schemes. There are 4 types of treatment schemes: the combined modality chemotherapy, neoadjuvant chemotherapy, adjuvant chemotherapy, and palliative chemotherapy. Combined modality chemotherapy, or also called combination therapy, is a type of treatment scheme where a number of different drugs are given simultaneously to the patient. It may be surgery plus chemotherapy or radiation plus chemotherapy. Cell cycle specific drugs are given initially, followed by cell cycle non-specific drugs in order to minimize the chances of resistance and toxicity. Neoadjuvant chemotherapy. This type of treatment scheme is a preoperative treatment, which means that it is delivered before the surgery. It aims to shrink the primary tumor or stop the spread of cancer thereby rendering local therapy like surgery or radiotherapy more effective and less invasive. Adjuvant chemotherapy. This type of treatment scheme is a post-operative treatment. It is administered after surgery to kill any remaining cancer cells with the goal of reducing the chances of recurrence. It is useful in killing cancer cells that have spread to other parts and also highly effective in newly growing tumors since they are fast dividing. Palliative chemotherapy. This type of treatment scheme is given without curative intent, but simply to decrease tumor load and increase life expectancy. This means that in this treatment, there is no intention of curing the patient, but to optimize the symptom control, improve quality of life, and ideally to improve the survival of the patient.